Hi, everyone. I'm Eric Sullivan, and here to welcome you to our Advocacy Grand Rounds for today, Beyond Build Back Better, Solutions to Improve Patient Outcomes. And just to introduce myself, I'm a current third-year resident at the Northwestern Family Medicine Program in Humboldt Park here in Chicago. Been with DFA since I was a medical student, former Capello Fellow working on drug affordability, and now help co-chair our federal legislation committee. And so really invested in this organization. Think we have a great talk for you here today. Before we get started, I just want to take a quick minute to encourage everyone who's here, if you're not already, to become a formal member of Doctors for America. Joining today means taking the important and simple step of selecting a membership level and paying very manageable annual membership dues. These are also at different levels in terms of price, for students versus residents versus new physicians can come in at a level that hopefully is more manageable for you depending on where you are in your career and training. One of our helpful administrators is going to put the link in the chat here. And as a bonus, if you sign up, you'll get a 10% discount to our upcoming leadership conference later this year in Chicago. So I might get to see you in person, very exciting. And now for our chat today, the purpose of today's session is we're going to be providing some information and education on the healthcare provisions in Build Back Better and how these reforms could lead to improved patient outcomes through increased accessibility to healthcare. And we're hoping that after you hear from our amazing speakers today and learn a little bit about how we got here and where we're going, you're going to be motivated to join us with DFA at our Day of Action in just less than 2 weeks on March 23rd. We're going to give you some more details about that later on. And just so everyone's aware, we are live streaming this to Facebook Live, and we're also recording this for our attendees who weren't able to make it in person today. And all of those will be available afterwards in case you want to review or share it with your colleagues. So before we introduce our great speakers here, just a couple quick ground rules, very basic. First off, no stupid questions here. All questions are encouraged. Our speakers want your questions. We want your questions. It's always more exciting when we have more participation. And then with regards to those questions, best way that you're going to get those to our speakers is by using the Q&A feature. The Q&A will kind of accumulate throughout the talk, so you can definitely put those questions in there as we go along. If something comes up that you want to circle back around on, we will keep tabs on those, and then in our second half, when we get to our Q&A, we'll come back to those questions. And we will be, periodically checking on the comments in the chat, but we're really actively looking into that Q&A feature to get things going. All right, and now without further ado, let me introduce our amazing speakers here today. So first we have Dr. Alastair Martin. He's a practicing ER physician and former chief resident at Massachusetts General Hospital, Currently, he works in the White House as an advisor on voting rights in the Office of the Vice President, as an advisor on health equity in the West Wing Office of Public Engagement as a White House Fellow. He's on sabbatical from Harvard, where he's duly appointed as an assistant professor at Harvard Medical School and as research faculty at the Harvard Kennedy School. Dr. Martin is also the founder of Get Waivered, a program that is converting our nation's ERs into the front door for opioid addiction treatment. He also co-founded GOT Vax, an initiative aimed at leveraging a Get Out the Vote framework to deliver vaccines to vulnerable communities via hyper-targeted vaccine clinics. And finally, in 2019, he founded Vote ER with a team of healthcare providers and behavioral science experts to help patients vote like their life depends on it. Thanks so much for being here, Dr. Martin. And then our other speaker is Dr. Rachel Madley. So she is a current legislative assistant to Congresswoman Pramila Jayapal. Dr. Madley leads the Congresswoman's work on health and environmental policy. Before joining the Congresswoman, she completed her PhD in microbiology and immunology at Columbia Medical Center. Dr. Madley also held leadership roles in multiple health justice organizations, including Physicians for a National Health Program and Students for a National Health Program. Her work has been published in multiple outlets, including Business Insider and the New York Times. And finally, Dr. Madley received her Bachelor's of Science from the University of Michigan. So with that, we will get started with Dr. Martin here with our advocacy rounds today. Thanks so much.
Thank you very much, Eric. And thank you, Dr. Madley, and thank you all for joining today. I've got some remarks that I want to share with you about the importance of Build Back Better and the provisions in it that mean so much to me as a healthcare provider. But before I begin, let me just keep it real with you. We have so much work to do to help align the rhetoric around health equity in this country and what it means to truly expand access to care and what's actually happening on the ground. For the patients that we take care of in places like ERs and community health centers and like the family medicine clinics that Dr. Eric Sullivan works, this is real. Some of these patients go home to empty fridges. Some of them don't have a home to go to. Some of them, the only reason they come to the ER is because they want me or you to write them a prescription because they don't have access to a doctor. And if we are going to do anything about these problems, it's going to take us working together to solve them. And I want to deliver two important messages up front. The first is, unfortunately, no one is coming. No one is coming to solve these problems for us in here. It is going to be up to us as care providers, as medical students, as nurses, as social workers, as physicians, as residents. I don't care what part of the training process you are in, you are not too busy to have a hand in helping to solve some of these really, really, really crushing and challenging problems that we have in the healthcare community. So that's the first thing. No one is coming. It's up to us. But you know, the other thing I know, you can't do it alone. And that's why it's so important to work with and be involved with organizations like Doctors for America. I was just with Dr. Civic Murthy a week and a half ago here, and Alice and Dr. Chen, his wonderful wife, and Ty. You all are part of, if you're not part of Doctors for America already, you should be. The work that they do is incredibly, incredibly powerful and incredibly important. And I urge you to, in whatever ways seem appropriate to you at the level of training that you're in, get in the game and let's help create a fairer and more just healthcare system. So I want to tell you now about some of the provisions in the Build Back Better Act that are so important to me, and also things that I think you should know about as we sort of enter a new legislative period here. But let me start the story back at the American Rescue Plan, because I think you have to have the first chapter to know why the subsequent chapters are important. So the American Rescue Plan put a ton of money, billions and billions and billions and billions of dollars, into subsidizing the care of healthcare in this country, $35 billion in fact. And it lowered everyone's premiums across the board, such that now 80% of Americans can get access to health insurance, good health insurance, for $10 or less a month. And that's vis-a-vis a program called the Expanded Premium Tax Credit. So remember that, put a pin in that, a metaphorical pin in that, provision, because we're going to come back to it. But it wasn't just about expanding access to healthcare, it was also about doing real and substantive work on the social determinants of health. So the American Rescue Plan put over $21 billion into the Emergency Rental Assistance Program to help people stay in their homes so they didn't get kicked out in the middle of the pandemic. It also put over $5 billion into the Emergency Housing Voucher Program to help folks who were struggling with homelessness get into homes. And then lastly, in terms of poverty alleviation, because there's no stress like the toxic stress of poverty, y'all. And when we address poverty head on, lo and behold, people get healthier, like we saw over the course of last year. The child tax credit put money in the pockets of middle to low income Americans and reduced child poverty across the board by up to 40%. So I want to start the conversation there, because we've got to know where we have come from to know where we're going in terms of Build Back Better. So many of you already know that where we're at now is the House has passed Build Back Better, and it currently sits in the Senate. And where we're at now is a conversation around what the future looks like in terms of the healthcare provisions of that bill and in terms of the larger provisions. So what I'm going to talk about is the pieces that pass through the House, okay? So number one, remember that expanded premium tax credit I told you about? Well, unfortunately, those subsidy dollars, they're going to expire. And they're going to expire at the end of this year, December 31st, 2022. Now, y'all, I hope that we are not dealing with a pandemic December 31st, 2022 at the end of this year. I hope we are not. But just kind of playing the odds, my sense is we're going to be dealing with some sort of vestige, some form of a pandemic by the end of this coming year. And what would not be a good idea is to have patients make a decision between, hey, you know, my health insurance premiums went up considerably this year. Should I get health insurance? Should I keep it? Or should I just save the money because I can't afford it? And so the Build Back Better provision that focuses on the expanded premium tax credit will effectively just extend those tax credits, reducing premiums for more than 9 million Americans. It's also going to expand healthcare coverage in states that have not expanded Medicaid. That's the states, there are 12 currently, who basically still have a Medicaid gap. Patients who are too poor to qualify for subsidies, but not poor enough to qualify for Medicaid. And so 4 million currently uninsured patients are in that potential pool. And then lastly, it'll require all states to cover postpartum care via Medicaid for 1 year. Right now, the requirement is 60 days. All right, so that's all facts. It's all important and definitely things to keep in mind. But why is this important? Why is this something that you should care about? There's a lot of talk about health equity right now. There's a lot of talk about, you know, how do we address disparities in care? And how do we take some of the lessons we learned from the Black Lives Matter movement and the post-Floyd moment that we're in? Well, listen, if we really want to address health equity, we need to make sure people have healthcare coverage, right? And the 3 points that I just hit at the end of the day are going to help ensure that millions and millions of patients have access to quality and affordable healthcare. Now, I want to switch gears for a second and tell you a story from about year and a half ago, before I came to the White House. I was taking care of a patient who had just come in. She was in her early 20s, and I'll never forget, you know, the team was sort of crowded around the computer desk, the computer terminal, and I was the attending on. I came over. I said, "So, you know, what's up, y'all? Tell me about the patient." And so one of my interns said, "Well, you know, we got this woman here. She's in her early 20s and she has diabetes, but, you know, crazy thing is, you know, she's here with DKA, and it looks like her sugars are all off, and she's you know, small breathing. It just looks bad. But the real crazy thing, Doc, is that she was just here last Thursday, and the conversation, you know, that we had around that computer terminal was, what's wrong with this woman? Why can't she manage her you know, insulin and her diabetes? Why can't she get it together? Right? What's going on? Is she on like a diet holiday, or is she, you know, forgetting or lapsing with regard to taking care of her diabetes? And so we kind of did that thing that healthcare providers sometimes kind of do, which is we projected onto this patient what we thought the story was, and we kind of moved on. And the story that we were telling ourselves was that this was a non-compliant patient. She was young, she probably has other things to do. And by the way, even though she was on DKA, she was in DKA, she was still on her phone on TikTok while she was in the stretcher. So long story short, I went by and I said, no, there's something here. There's something else here. This doesn't make sense. I also wanted to see what video she was watching on TikTok. So I came over and I said, listen, you know, I just noticed that you were were just here a couple days ago with DKA, and you're back again. This is a really rare thing to get twice in a week, and I just wanted to get a sense from you, what's going on? And she told me, well, doc, you know what happened? I got a new job about a month ago. And because of that new job, I now make too much money to qualify for the subsidies that I was getting. And I've had to make a decision. Do I want to have health insurance or do I not want to have health insurance? And for this young woman who was probably 23, 24, it made more sense for her to save her money and not have health insurance. And the result of that was she was paying out of pocket for insulin. And twice in 1 week, she dodged a bullet, life-threatening disease that she, was subject to, diabetic ketoacidosis, was only the result of her having to ration her insulin. She was paying hundreds and hundreds of dollars a month. And so this is real, y'all. And if you haven't seen this yet, you will see it. You will take care of a patient like this who is struggling to make decisions about, do they pay for their medications or do they pay for their internet bill, right? And that's why one of the provisions that's so important to talk about, make sure you all understand, is that the Build Back Better version that passed through the House will cap the cost of insulin at $35 a month. But it's not just that. It's not just capping the cost of insulin at $35 a month so that patients like the one I told you about don't have to make those hard decisions anymore. It also allows for Medicare to negotiate drug prices, particularly for high-cost prescription drugs. And those two things go hand in hand because we need the cost savings for those high-cost prescription drugs and the negotiations from that to fund some of the other portions of the program. There's a number of other really important things like helping older Americans access affordable hearing care by expanding Medicare and by permanently improving Medicaid coverage for older Americans and people with disabilities. The last thing I'll say on this is, when we talk about health equity, we must always include talking about the social determinants of health. You saw when I mentioned the American Rescue Plan, we talked about what? We talked about poverty alleviation, right? We talked about keeping people in their homes. We talked about, for the homeless, getting people into homes. Well, that's going to continue in the Build Back Better House passed version, vis-a-vis continuing the housing investments by making the single largest investment in affordable housing in history, with the education components that passed through the House, making preschool free and universal for all 3 and 4-year-olds, which is big. Childcare for the parents in the audience or folks who are know your friends who are at that stage now. I'm sure they're paying lots of money to try and make sure the childcare costs are being covered. And so in the Build Back Better House version, families will pay no more than 7% of their income on childcare for children under 6. And there's a number of other really, really important initiatives on climate change, on food insecurity. The bottom line is we need you to know about this, and we need you to make your voices heard, because it's incredibly important to make sure, again, that our rhetoric when it comes to health equity lines up with the actions and the advocacy work that will make sure that we move towards a fair and more just healthcare system. I'm going to pass it over to Dr. Rachel Madley to talk a little bit more about what the future could look like.
Thanks so much, Dr. Martin. And I think that was an amazing overview of where we have come since before the rescue plan, and now to the House passing Build Back Better. So I am going to talk a little bit about what is possibly going to happen next on Build Back Better. And then I'm also going to talk about what the title of today's grand rounds are, which is Beyond Build Back Better, and kind of what Congresswoman Jayapal and a lot of others in Congress are thinking about as the next steps to continue to address those health disparities that Dr. Martin was talking about and make real transformational change for patients on the ground. So in terms of Build Back Better, we were very happy to see it pass the House. that was something that the Congresswoman has worked incredibly, incredibly hard on. And I can say, actually, I began working in the office in July. So truly my entire time in the office has been working on Build Back Better. So we were happy to see it pass the House. However, as many of you know, it stalled when it reached the Senate. And recently there have been some remarks and some momentum around Build Back Better or another type of reconciliation package that could move forward. Now, what that package will look like is still very much up in the air, and it's being decided as we speak. Of course, the Congresswoman is continuing to push for the boldest package that we can get, including a package that goes as far on healthcare as we can. And so I think right now, again, the momentum is really increasing, and it's a really, really important time to hopefully get this package across the finish line. Now, in terms of next steps after Build Back Better, there are a few buckets that the Congresswoman and others in Congress have been focusing on. Now, the first one is Medicare expansion. And Dr. Martin mentioned that the House passed Build Back Better Act includes expansion of Medicare benefits to include hearing. And that was something that we pushed for very, very strongly because, of course, seniors need access to hearing aids. Not only that, we were also pushing for a broader expansion of Medicare, and we're continuing to push for that. And we mean Medicare expansion in two ways. The first way is lowering the Medicare age. So this is something that was one of Congressman Jayapal's priorities, as well as the Congressional Progressive Caucus's priorities going into Build Back Better. And although it didn't make it into the bill, it's something that we are pushing for as a next step. And studies actually show that the US has the highest mortality rate compared to peer countries by age until we reach 65. And once we reach 65, our mortality rate drops to among the lowest of our peer countries. Now, 65 seems to be that magical age in other studies as well. There was another study that showed that cancer diagnoses spike specifically at the age of 65, and typically those diagnoses are further stages of cancer. Now, what is so important about this age 65? It's when Medicare kicks in. And so it's when folks are able to get the comprehensive health care that they need. And unfortunately, a lot of folks have put off getting cancer screenings. And so that's why we see that uptick of cancer diagnoses at 65. And if they could get their care earlier, studies have shown they would have much better outcomes. It's also when our life expectancy becomes among the top rated compared to peer countries, again, because people can access the care that they need. And so the Congresswoman is really pushing for lowering the Medicare age because Medicare is such a popular, trusted, proven program to improve health in our country. And right now, coming out of the COVID-19 pandemic, as we're slowly trying to reach the end of the pandemic, people are trying to return to employment, coping with long COVID symptoms and things like that. And so lowering the Medicare age will really allow older Americans to get the care that they need. So we were very excited to lead the coalition in support of lowering the Medicare age, along with a broad base of support throughout the Democratic caucus. And that's something I think that everyone should be very excited about because we see in the news, there's all the articles about, progressives versus moderates versus this versus that. But lowering the Medicare age is something that folks throughout the caucus on all sides of the ideological spectrum have rallied around. So we actually led a bill to lower the Medicare age with frontline Democrats. Those are the Democrats that are in the toughest districts to win, the most purple districts, and they are leading on this issue as well because they're hearing from their constituents, from your patients, that they need to be able to access Medicare earlier. They need to be able to retire earlier. And so lowering the Medicare age, we believe, is an incredibly, incredibly popular and effective way to improve the health of your patients and our constituents. And so we're continuing to push on that, and we're very excited to see that momentum is building to do that. Now, another way that we are hoping to see Medicare expanded after Build Back Better is not only adding hearing benefits like BBB will do, but also adding dental and vision benefits into Medicare. Because again, as you all know, your teeth are part of your body, your eyes are part of your body. And I'm sure you're seeing patients who are seniors who cannot access dental and vision services because they can't afford them. And so we want to push to make those Medicare benefits as comprehensive as possible. And again, this has very, very wide support throughout the Democratic caucus, and it also has bipartisan support in the public. So polls have shown that a majority of both Democrats and Republicans support expanding Medicare by lowering the age and adding dental and vision benefits. And so we see the momentum building for that. We are continuing to push it, and we think that this is the way to go as a next step after Build Back Better. Now, the next bucket in terms of next steps is strengthening drug price negotiation. So in the House passed bill, as Dr. Martin mentioned, Medicare will finally be able to negotiate drug prices. And we were very, very happy to see this step taken because it's an incredible step forward. In terms of next steps, what we want to do is strengthen that negotiation even more, because as you're all aware, and as Dr. Martin so eloquently pointed out, drugs like insulin are so expensive that they are out of reach of patients. And so we want to make sure that Medicare can negotiate on as many drugs as necessary. And so the next step after Build Back Better, which specifies a number of drugs that Medicare will be able to negotiate the price on, we want to increase that number. And in the House passed Build Back Better Act, the negotiation cannot start until after the exclusivity period has ended. We want to make drugs eligible for negotiation as soon as possible, again, so that we're not locking patients out of being able to get the drugs that they need, because there is so much medical innovation happening, but we have to make sure that those drugs can get the last mile, right? They were worked on in the labs, they passed through clinical trials, but we have to make sure they can get to patients and they can get to all patients who need them. So that's something that we are focused on for our next steps. And again, Dr. Martin's story about the patient who was in DKA, I think really illustrates another next step that we are trying to take. So we are really excited to see the insulin copay cap in the House passed Build Back Better bill. One thing we're pushing for is we want that cap to apply to uninsured patients as well. And we think that that is the way to ensure that patients are not falling through the cracks if they switch to jobs and had a gap in their insurance, if they are somehow in the Medicaid gap before we can get Medicaid expansion passed. And so we really want to make sure that, first of all, whatever insulin cap is in the final Build Back Better includes the uninsured, but also we need to transition to not a copay cap, because a copay cap is still allowing pharmaceutical companies to charge their egregious prices. So we want to push for a price cap. We want to make sure that pharmaceutical companies, whether it's through Medicare negotiation or through some other type of price controls, cannot price gouge insulin and other drugs like that anymore. And the third bucket, which I'll touch on, is we want to keep expanding access to healthcare. And Dr. Martin spoke about how this has been done in the American Rescue Plan. It's going to be done in Build Back Better, but we want to keep taking those steps until we can truly say that everyone in the US has universal comprehensive healthcare, and there are no obstacles to them getting that healthcare, whether it be cost, location, or any other possible difficulties. And so, as many of you may know, Congresswoman Jayapal is the lead co-sponsor on Medicare for All, but in general, we are wanting to talk about ways that we can keep moving toward a universal healthcare system where all of your patients are covered. And I know we're not specifically talking about Medicare for All today, but we really think that while we are trying to rebuild after the COVID-19 pandemic, we have a chance to transform our healthcare system. And we're starting with what's in Build Back Better, but we want to take those next steps. We want to expand Medicare. We want to lower prescription drug prices, and we want to look at our healthcare system holistically and see how we can make sure that patients are able to get the care they need when they need it, and they don't face the obstacles that they face today. And so I really think that this is an amazing time to be in health policy, but also in healthcare. And I know that the pandemic has been incredibly stressful on all of you on this call who have been on the front lines. And I wanted to make sure that you know that for me, working in the Congresswoman's office and for the Congresswoman, it's so incredibly powerful to be able to speak to you all today, but also to be able to hear from you and your experiences and how these policies are actually shaping patient lives in your clinics, in your hospitals. And so I am so excited that all of you tuned in today, and hopefully all of you are members of Doctors for America. But I just want to really emphasize the power in staying involved in health policy, because from my end on the Hill, it can't be overstated how helpful and how powerful it is to hear from you about how these policies are working and what we need to improve. And so I will hand it back to Dr. Sullivan.
Thanks, Dr. Madley. Really appreciate all the details there about where we could be going. It's super exciting, especially for someone like myself who's about to start his career, and who hopes that my patients will have a better world than the one they're in now. So we're going to turn back to Dr. Martin now for a little more commentary, and then we'll get to the Q&A after that.
Thank you very much, Dr. Sullivan. I want to come back to Dr. Madley's point, which is just so spot on. There has never been a better time to get involved with health policy than right now. There has never been a better time. We're coming off the tail end of a pandemic, and everyone's eyes and attention are focused on the healthcare and public health sectors. And what we need now are folks who are ready to pick up a shovel and get to work and help to remake what our healthcare system can look like. And I'll tell you that there's no better example of how important healthcare is right now than the President's State of the Union speech last Tuesday. So I was here at the White House watching the feed, and like everyone else, I actually didn't know what he was going to say. I didn't have any sort of inside information. I didn't have access to the speech. But when the president unveiled his unity agenda, I understood the moment that we were in with regard to healthcare policy being at the front and center of everyone's mind when it comes to kind of the political priorities. All right, let me give you the 4 points of the unity agenda, and then I want you to make your own conclusions about where healthcare stands. So point 1 in the unity agenda was recreating our federal government's approach to addressing the opioid epidemic. Point 2 was reigniting the cancer moonshot, which is a whole of government approach to addressing cancer. Point 3 was reconfiguring our federal government's approach on how we address mental health in this country and dramatically expanding access to mental health care. And point 4 was on veterans. So if you're keeping score, of the 4 pieces of the unity agenda, 3 of them are healthcare related: opioids, cancer moonshot, and mental health. And we need healthcare providers to be at the table and to understand the importance of healthcare policy, because none of this is solidified. All of this is up for discussion. And it's now our turn and our time to help recreate sort of what the future looks like. So let me tell you a little bit more about each of these pieces, each of the 3 points of the union agenda that I just talked about. So first of all, with regard to the opioid epidemic, across the country, the challenges brought by the pandemic resulted in over 104,000 Americans who died due to a drug overdose. And that's during the pandemic, and that's unfortunately a record. The administration is committed to taking a decisive action to address addiction and the overdose epidemic. And the president laid out a vision for how the administration is going to do this. And so there are three important things that I heard with regard to the approach. Number one, increasing funding for addiction. Number two, removing barriers to treatment. Number three, supporting harm reduction programs. So to increase funding, the president in the 2022 budget requested a historic $41 billion for drug policy efforts. So it's going to bridge the gap between those who are in need and the resources they need to help overcome their addiction. Number two, to remove barriers. There are so many just nonsensical barriers still that we can do a lot of work on to try and address, and the administration is going to be addressing those things, like the X waiver, and making sure that doctors don't have any barriers to prescribing FDA approved and gold standard medications to the patients. And then lastly, in terms of supporting harm reduction programs, the president has, for the first time in history, made harm reduction services, which are things like test strips, drugs like naloxone, et cetera, a federal drug policy. That's a huge shift that the federal government is acknowledging and putting support behind harm reduction programs. And it's not just support, it's money too, $30 million in support for harm reduction services. But at the same time, the country is also facing an unprecedented mental health crisis among people of all ages. And that's why the president laid out a new vision in the State of the Union to address mental health and to transform how mental health is understood, how it's accessed, how it's treated, and how it's integrated both in and out of healthcare settings. And so the president announced a national mental health strategy to do three things. Number one, strengthen system capacity. Number two, connect more Americans to care. And number three, create a continuum of support. So we're going to go through those. Number one, to strengthen system capacity, the administration will invest in proven programs that create more mental health clinicians, right? We need more mental health clinicians in this country, particularly pediatric. And it'll do that by investing over $700 million in initiatives that provide scholarships, money, okay, scholarships, loan repayment, really important, and also training to help folks go into mental health care. It'll also launch the brand new 988 crisis line. So if a patient is struggling with a mental health issue, not calling 911 anymore. We're not having a police officer go to that incident. We're having mental health responders go to that patient and hopefully help. So think about what the next steps look like. That's the 988 number, super exciting. Number two, in terms of connecting Americans to care, the administration is going to expand access to mental health options via telehealth by making sure that we work with Congress to ensure coverage of telehealth across health plans and across state lines. And it will expand access to mental health support in schools and colleges by budgeting $1 billion to hire additional school counselors throughout our public school system and psychologists so that kids have access when and where they need it. And then lastly, to create a continuum of support, the administration will institute stronger online protections for young people. It'll strengthen children's privacy and ban targeted advertising for children online. And it will invest in research on social media's mental harms. It's also going to set up students for success by using the $122 billion in the American Rescue Plan to address the impact of the pandemic on student learning loss. So that's the work that's happening on mental health. And I want to tell you the last piece about cancer, right? Because we can't forget the impact that cancer has had on communities nationwide. For example, in the last 2 years of the pandemic, we've lost more than 800,000 American lives to COVID. It's a lot. But in that same time period, we've also lost over 1.2 million Americans to cancer. And so we need to make sure that we're also focusing on addressing and advancing the way that we take care of cancer in this country. And that's why the work around a reignited Cancer Moonshot or Cancer Moonshot 2.0 with renewed White House leadership is so important. The Cancer Moonshot will do a number of things, but basically it'll build on a quarter century of bipartisan support, public health progress, and scientific advances by doing three things. Number one, mobilizing a whole of government approach to ending cancer as we know it. Number two, issuing a call to action on screening and early detection. And then number three, forming a brand new cabinet to bring together departments and agencies across government to address cancer on multiple fronts. So as you can see, there's a lot going on. And back to Dr. Madley's point, it has never been more important, I think, than now to get involved in healthcare policy and to get in the game. Eric is going to, Dr. Sullivan is going to talk about some calls to action. I want to put a couple in front of you right now, and we're going to definitely hit a couple of these as well in a second. But number one, if you're interested in learning more about what the White House is doing on healthcare, email me. Dr. Sullivan's going to make sure that you guys have my email address. Number two, I want to flag the Doctors for America Advocathon, which is the first time I ever heard the word Advocathon. I love it. It's a great term. Their Advocathon Zoom room is on March 23rd between 12 and 4. Dr. Sullivan will tell you a lot more, but I have to highlight that because there's nothing else like just getting in the game and getting started. And I promise you, it's going to be an incredible learning experience. And then lastly, for those folks who are interested in long-term community organizing training and getting better as a community organizer yourself, consider the Civic Health Fellowship with ODR. It's a 6-month community organizing training program taught by a Nobel Prize nominee who is a community organizer in Serbia. And he is exceptional, really gifted, and is teaching healthcare providers like you all across the country the fundamentals of community organizing. With that, I'm going to hand it back over to Dr. Sullivan.
Thanks, Dr. Martin and Dr. Madley for those great talks that you gave. I think all of us learned a lot. I know I feel a lot more up to speed on where we came from and where we're going. So I don't want to waste too much time. I'll get right into the Q&A here. So got a couple questions here that I'm going to consolidate, asking about how we as the physician community and maybe more broadly should be communicating the Build Back Better message. It seems like there's more of an emphasis on the components now. Is that how people should be talking about this to their colleagues? Because some people are writing in the comments and you've heard anecdotally through the media that there may be a negative connotation to Build Back Better now in some places in certain states and localities. And specifically, are there pros and cons to using, one versus the other, emphasizing the components versus the Build Back Better as a package? And is this something that people should be tailoring to different populations, different environments? Feel free, either one of you, if you both want to chime in on that one. I think that goes to the heart of what we're talking about today.
That is a really great question. I think initially it's going to depend on who you're talking to, right? If it's someone who's been supportive of Build Back Better, you have a little bit more leeway to refer to it as that or something else. I think in terms of strategy, as the president laid out in the State of the Union, and as we've been discussing within Congress, it seems like we are moving away from the name Build Back Better, but that doesn't mean we're moving away from any of the components. We're still pushing on that. And so I think you are correct that Build Back Better has some complex connotations, and so it does not have to be called that. I think pushing for the specific components is really, really helpful as well, because as it moves forward in the Senate, there is space for things to be cut from the package. And so as healthcare providers, you want to make sure that when you're meeting with legislators or anyone else, you are making clear exactly what part of Build Back Better or parts are important to you, so that when it comes to it, if things are getting cut, folks know that there is a wealth of support for the health provisions and that they should not be touched. I know in our office, we are focused a lot on getting as many of the provisions into the final package. That being said, the Congresswoman has been very clear that we do not negotiate against ourselves. And so we are not going to start proactively cutting it down and saying, well, we'd be okay if you removed this or that. So instead, I would suggest really advocating for the pieces that are really important to you. And so the healthcare pieces that we have talked about today. And in terms of what it's looking like in the Senate, it does seem that there may be more agreement around, and this has been reported publicly, maybe more agreement around the climate provisions, and then those being funded by tax reform and prescription drug provisions. But there is some room for some of the care pieces to be in there, including the healthcare pieces. So that's why I think being specific about what components of Build Back Better you are advocating for is the best way forward.
Perfect. So the next thing that I think builds right on top of that is that what do you both think are the most effective things that healthcare providers and especially physicians can be doing to educate the public about these provisions? It seems there's a concern in articulated in this question about the misinformation that's out there. Again, concern about whether people even realize that Build Back Better is still moving forward. And a little bit of pessimism, I know among the healthcare community about whether there's still time for those of us who are passionate about these issues to make a meaningful difference. If you could just comment on maybe some of the things that you think people who are feeling that way can maybe do to get themselves revved up and out there and being effective. I know Dr. Martin, you already touched on some of the parts, but if anything else that hasn't come up already.
Look, I think there's so many things that you could focus on, and there's so many directions that you could go. And I think ultimately, simplicity and prioritization matter a lot. So if there were only one thing that I want you to focus on from this conversation, at least for my piece, it's that the Affordable Care Act subsidies are going to run out. It's going to run out. It's by law. And those subsidies are going to run out on December 31st of this year. I haven't read one op-ed that's talking about that. I know some of you want to write op-eds. I know some of you want to be published. So bottom line is there's a ton of room to the public about why that specific provision is so important and why it's so important to get that across the finish line in whatever vehicle or whatever package, call it whatever you want. The importance of making sure people have coverage in the midst of the pandemic is just, we shouldn't have to negotiate about that. So I would say start there, but it's not just writing op-eds. You can make your voices heard on social media. I recently, I was embarrassed to find this out the other day. The traffic to one of the doctors that we work with here on one social media post that they put out was 3 times the number of page views on an op-ed that was written by a team of doctors. All right, I'm gonna repeat that. One doctor and her post on social media, on Twitter, had more interaction and engagement than a team of doctors writing one op-ed. Now, I'm not saying don't write op-eds, but I'm saying, you don't have to just put all your eggs in that basket. And probably some of y'all are digital natives who really understand how TikTok works. I'm still figuring out TikTok, but y'all probably not figuring out TikTok. You guys probably have it down. You know what I'm saying? So you can use some of the skills that you already have to get the word out about some of these provisions and making sure that folks are up to speed.
And I would just add, I think something that I actually struggle with, being a scientist by background, is making sure that you're not just talking about the policy, but boiling it down to what it's going to look like in people's lives. So if you're doing public education, what is it actually going to look like for your patient? I saw a great table the other day, and I think every state should be able to provide folks with this information, but you just have to ask of what they pay now, what a family making $50,000 and $100,000 pay now for ACA subsidies versus what they're going to pay when the subsidies expire. And the difference was about $5,000 a year. And so putting it in dollars and cents, or talking about, if Medicare expanded hearing access, here's how easy it would be for you to get a hearing aid. I think just making it as simple as possible so people can see in their mind what these changes would do is really, really powerful, because sometimes policymakers get lost in the bill text and all of that, but hearing a family is going to have to pay multiple thousands of more dollars on healthcare per year if you don't do this is a very powerful, very clear message.
Great. Well, thank you both for giving some people some tangible next steps that they can do. And just to summarize, I just want to put out that people should be getting their voices out. And now, whether that's through op-eds, whether that's through Twitter, Facebook, TikTok, I have bless those souls who know how TikTok works. I'm still getting there. So I think the most important thing that I'm hearing from both of you is just making that voice heard, and whatever the most comfortable way you have to do that. Whether that's through newsprint or whether that's through 280 characters on Twitter, however you can get those patient stories out there is going to be the most effective. And so I think the next question that we'll turn to here gets a little bit more in the weeds, and it's directed specifically to Dr. Madley, hoping that you will comment on the goal of lowering the Medicare age with the apparent, per this questionnaire, I do not know this myself, but per the administration's goal of privatizing Medicare through increase in Medicare Advantage and direct contracting / ACO REACH programs. They specifically want to know that since Medicare Advantage is so much more expensive than traditional Medicare, won't this increase the cost of Medicare by providing profits for investors? So feel free to take any of that and get at it. You probably understand the nitty-gritty of that more than I do.
Definitely. So that's a great question. What I can say overall is the Congresswoman really tackles the issues in healthcare from all different angles and simultaneously, because nothing happens overnight. So while we're pushing to lower the Medicare age, we are not saying that Medicare is perfect and that nothing should be changed about it. And I think your point about the Medicare direct contracting program, which for those of you who are unaware, this was a program started under the Trump administration in an effort to bring in private entities to administer traditional Medicare benefits. Now, this is something that the Congresswoman led a letter asking the administration to end. We've been talking to CMS a lot about this because we are very concerned that more private entities in healthcare are going to get in the way of that patient-doctor relationship, especially in Medicare. And so while we're talking about lowering the age, we are also making sure that we are improving Medicare while we try to lower the age, because lowering the age, to be very real with you, is not going to happen overnight. And so as we build the momentum to get there, we are also working to make improvements to Medicare, meaning ending those private entities being involved in traditional Medicare. We also recently submitted a comment letter to CMS asking them to readjust how they calculate payments to Medicare Advantage, because we do recognize, and even, the Congressional Budget Office even recognizes that Medicare Advantage is much more expensive than traditional Medicare for no medical reason. So we are working on making those improvements, and actually our bill to lower the Medicare age also improves the low-income subsidy program for Medicare to make sure that low-income beneficiaries are not automatically forced to choose a Medicare Advantage plan just because it offers no premium or a zero premium option. And so it's a really, really great question. And it's something that we are choosing to work on in a parallel track. So we want to expand Medicare, but we also want to improve it before we get to expanding Medicare. But lowering the Medicare age is going to take a while. So we want to start building the momentum.
Perfect. Thank you for touching on that. I really like the getting in the weeds of this stuff. So I think that was a really illuminating answer there. And this will probably be our last question. And I think this is a helpful one to end on, because it talks about keeping everyone involved. And I think you can also broaden this out as well from where the original question asker took it. But the questioner asked, do you think that you can get Republicans on board to improving healthcare access for everyone if the emphasis pivots to Medicare Advantage for all? I think broadening that question out to kind of wrap things up here, how can we get the biggest support across the aisle for the provisions that we've talked about today, and what are the risks of pivoting to bigger aspirations like the Beyond Build Back Better that we talked about earlier. And feel free that Dr. Madley or Dr. Martin, if you both want to get on this, either way, totally fine.
I can get us started. You may have to follow up with me offline fully for that, but I think the things that come directly to mind with regard to the question of what pieces can we all agree on when it comes to healthcare in this country. I think the President's State of the Union speech really nailed some of the biggest areas where we can move forward in a bipartisan way. And his Unity Agenda, covered opioids, which, by the way, the opioid epidemic impacts red states just as bad as blue states, and in some cases even more in rural communities. Cancer, and making sure that we address that disease head on, because cancer does not see partisanship. And then lastly, mental health, because also mental health doesn't care about if you're Republican or Democrat. So I think those three pieces of the Unity Agenda really were a nice place for all folks who care about the health of the American people to kind of all agree on and move forward.
And just building on that, I think when we talk about bipartisan support, I think there's a difference between bipartisan support in the public, so voters who identify as Democrat or Republican supporting something, and then bipartisan support of members of Congress. And I think there's a lot of room, and we actually already see a good deal of support for Medicare for all and lowering the Medicare age and all of those other steps forward in the general public from both Democrats and Republicans and independents. And a poll actually after the start of the pandemic showed that about 40% of Republicans were more supportive of a universal healthcare type system after the pandemic had started. And so in that way, I think getting bipartisan support from the public is really about what all of you are here to do, right? Which is education of your patients and also of lawmakers. But I think there's such an appetite for a change in how we deal with healthcare in this country that there is a road to bipartisan support in the public. It's already there. I think it takes having some of those longer conversations with voters and patients to really get at their fears in the healthcare system and what we can do to fix it. In Congress, I think it's a little bit different because there is a hyper-partisan climate right now. Obviously, we would welcome bipartisan support on some of these initiatives, but I think we have to build the bipartisan public support for these bills, and that will lead us to hopefully bipartisan support from members of Congress. And so we would welcome that, but I think we have to start with the Democrats and Republicans on the ground and in our communities, and really build that groundswell of support, because I do see an avenue there.
Great. Thank you both for wrapping it up on that message of bringing people together. So I just want to close today's event by thanking you both again, Dr. Alastair Martin and Dr. Rachel Madley, for having this great conversation. We were so grateful that you were able to take time out of your very busy days in Washington to come speak with us and the members of the DFA community. And now, like was touched on earlier, I just want to call attention to our next collective action here at Doctors for America. You heard about a lot of opportunities to get involved today, and I'm going to give you one that you can sign up for right now. Our day of action at Doctors for America is going to be on Wednesday, March 23rd. It's going to be taking place, excuse me, between 12 and 4 Eastern. And this is going to be our Advathon Zoom room. So you will, when you register and get the Zoom link, you'll come to this Zoom room with members of the DFA community and administrative staff. They are going to give you everything you need to reach out to your congressional delegation on many of the points that we talked about today. There'll be call scripts. Literally, if you don't want to do any thinking, you don't have to. If you just want to get out there and advocate, we're going to give you all the tools to make you successful. Shouldn't take you more than 20 to 30 minutes at most, possibly even less than that. If you just want to show up, get your call strip, start calling. You could be in and out of there and still have plenty of time during your lunch hour to enjoy a very robust lunch. But if you do want to stay longer, we will be there that whole time. And if you want to keep making calls or just chat with the community, we'll be staying on to help and build on that process. So you'll get a link here in the chat today. Go ahead and register right now, get it in the calendar. I know if it's not on my calendar, it doesn't exist. So please put it in your calendars if that's something that is important for you. And then I'm just going to give you a couple other reminders here. The event today was recorded and will be available later on our YouTube channel. Angie has been putting our helpful survey link here, very short, literally just helps us build better content for you and help to get you more involved. So you can take it just a couple minutes to fill out that survey. That would be much appreciated. Our next informational event is coming up very soon on March 15th at 7:30 Eastern. We're going to be collaborating with Physicians for a National Health Program New York for a joint event called The Price is Wrong, Why U.S. Prescription Drug Prices Are Too High and How to Treat It. We're giving you that link in the chat right now. And then our next Advocacy Grand Round, so an event just like this one, will be taking place in almost exactly 1 month. That event will be called Accelerated Approval Reforms, Balancing Timely Access and True Clinical Benefit. And that again will be at 1 p.m. Eastern on April 14th. And then finally, if you're liking what you hear today, you just want to stay involved, we do have a Doctors for America Twitter, a Facebook, and a LinkedIn, in addition to the YouTube channel. So please subscribe to all those things to stay up to date if you want to keep getting awesome information like the stuff you've heard here. And with that, I will say thank you again to our panelists. Thank you again to our background staff making everything happen. And thank you to everyone for coming. It was so great having you, and we hope to see you again soon.
So.
Thanks, everyone.